Thank you, Deputy Speaker, and I want to give a very big happy 40th birthday shout out to Medicare today. After a decade of Liberal government cuts and neglect, we now have a government that fully understands the value of investing in universal healthcare, and the results are showing. On November 1, the Albanese Labor government tripled the bulk billing incentives for GPs, making trips to the doctor cheaper for children, for pensioners and concession card holders. That change has resulted in an increase of 2.7% in the bulk billing rates in Newcastle. That means 1,300 more bulk billed visits since November and a savings of $61,000 to Novacastrians. It's helping people like Matthew of Carrington, who wrote to me saying, "Sharon, I want to thank you and the government for tripling the bulk billing. My health was failing because I couldn't afford to pay to see a GP. Just found a wonderful doctor who not only bulk bills but is very caring and getting my health back on track." By the government increasing bulk billing, I'm now able to visit the doctor more on a regular basis. Another constituent who's a pensioner told me of her relief at being bulk billed at her last visit to the GP. When she found out it was because Labor had tripled the bulk billing incentive, she said, "This is such wonderful news, as I feel like I can now go to the doctor more often and not put it off." These are great stories to hear, but sadly, they're still not commonplace. Our incentives are very carefully targeted to the most vulnerable cohorts in our community. Yet I know there remains many people struggling to get access to a bulk billing doctor in Newcastle. Everyone should have access to affordable, quality primary health care. That's what Labor stands for. But the former government's successive cuts and neglect of Medicare has left our GP system in a state of crisis, particularly in Newcastle. It means that while rates are now, for the first time in 10 years, they have stopped the downward spiral, they're stabilising and we've seen an upward trajectory. But it's a base that we start from is very low. And I really encourage Newcastle's GPs to take up this financial incentive and consequently pass on critical savings to their patients by providing bulk billing services to those in need. And to Novacastrians, I ask that you stay in touch with me and my office so we can help track those changes, so I can hear firsthand the difference that you are seeing in your health as a result of GPs taking up these incentives to do bulk billing. We still have lots to work to do, but the recent uptick in the bulk billing rates is very heartening. As I said, it's put for the first time in 10 years a stop to the downward spiral, but there is more to do.